The Doppler-CIP is looking at determining the change in end diastolic volume, that is remodeling of the left ventricle in patients with chronic ischemic heart disease. The study was perceived as being a real-life study, so we weren't really doing a specific intervention. We're looking at patients who have ischemic heart disease either because they've had previous myocardial infarction, or because they've had an intervention, a PCI or a CABG, or because they have a positive stress test showing ischemia. The number or the percentage of patients that remodel when they have large ventricles is about 20%. So they do remodel, but the ones that are small remodel at a rate of about 35 to 40%, so nearly double the rate of the ones that start out with larger ventricles. And if you look more carefully at those are ventricles that have a small volume, that's what I was saying, but also a high left ventricular mass. So if you take the ratio of those two, that is a small ventricle with a thick myocardium, then you're looking at ventricles that really have low wall stress. And again, that goes against the thought that we have today, that it are the ventricles with high wall stress that get stretched and therefore remodel. While what we are seeing in this study is that it are the ventricles with low wall stress that seem to want to increase their wall stress. And actually, when we look at what happens to them, in short term, that is only 2 years now, of course, they tend to improve their function rather than decrease their function. We need to follow them further to see if that is sustained over a longer period of time. But I think we need to rethink remodeling and see that there can be bad remodeling, and that is the path towards heart failure, but there is also such a thing as good remodeling, and an increase in size of the ventricle doesn't necessarily mean that you're doing a bad thing, and therefore it might impact on how we are looking at these patients and therefore at our clinical practice, because it's not just the ones that are big that are bad. Conclusion is that remodeling needs to be rethought. We need to look at remodeling not just as only a bad thing and only happening to large ventricles. It can also happen to small ventricles, and it doesn't necessarily mean that it's a bad thing to happen to that ventricle.